In this presentation, focus on inflammatory brain disorders, we'll talk about encephalitis and brain abscesses. Encephalitis literally means an inflammation of the brain, but it usually refers to brain inflammation caused by a virus. It is a rare disease that only occurs in approximately 0.5 per 100,000 individuals, but most commonly in children, the elderly, and people with weakened immune systems. Viral encephalitis may develop during or after infection with any of several viral illnesses, including influenza, herpes simplex, measles, mumps, rubella, chickenpox, and arbovirus infection, including the West Nile virus. Herpes simplex type 1 virus is one of the more common and serious causes of viral encephalitis. Herpes-related encephalitis can erupt rapidly and may cause seizures or mental changes and even lead to coma or death. And it occurs when the herpes simplex type 1 virus travels to the brain rather than moving through the body to the surface of the skin and producing its more common symptom, which is a cold sore. Early recognition and treatment of herpes encephalitis can be life-saving. Arbovirus encephalitis is another form of viral encephalitis, and it is caused by various viruses that are carried by arthropods, which include insects such as mosquitoes and ticks. Unlike herpes, arboviral infections are seasonal, occurring primarily in summer and early fall, and are clustered in specific regions. In rare instances, bacterial, fungal, parasitic, or rickettsial infections cause encephalitis. Cancer or even exposure to certain drugs or toxins may also cause encephalitis. Most cases have mild flu-like symptoms, and 1 in 150 cases will result in severe neurological disease. The risk of contracting West Nile encephalitis is greater for all residents of areas where active cases have been identified, but persons older than age 50 or those with compromised immune systems have the greatest risk. Birds are the reservoir of the West Nile virus. They harbor the virus but are unable to spread it. Mosquitoes serve as the vectors, spreading it from bird to bird and from birds to people. Symptoms in milder cases of encephalitis usually include fever, headache, poor appetite, nausea and vomiting, a loss of energy, and just a general sick feeling. Symptoms may appear in 2 to 3 days. But they vary from minimal alterations to a coma, more serious symptoms. In more severe cases of encephalitis, a person's more likely to experience high fever and any of a number of symptoms that relate to the central nervous system, including severe headache, stiff neck, confusion, disorientation, seizures, problems with speech or hearing, personality changes, and convulsions or tremors and cranial nerve palsies, possibly even hallucinations and memory loss. And as we failed to mention here, hemiparesis, certainly weakness on one half of their body. Most people with encephalitis make a full recovery, But in a small percentage of cases, swelling of the brain can lead to permanent brain damage and lasting complications like learning disabilities, speech problems, memory loss. So things like speech and physical or occupational therapy may be necessary in these cases. Rarely, if the brain damage is severe, encephalitis can lead to death. Because antibiotics aren't effective against viruses, they aren't used to treat encephalitis. However, antiviral drugs can be used to treat some forms of encephalitis, especially the type caused by the herpes simplex virus. Corticosteroids may also be used in some cases to reduce brain swelling. And certainly if seizures occur, anticonvulsants may also be given. This slide encapsulates the many symptoms that can be lasting or complications that can be lasting in a small percentage of cases of encephalitis. Sometimes they do have these complications that are listed here: learning disabilities, speech problems, memory problems. They can even have physical lack of muscle control, physical problems, lack of muscle control. So there's a whole host of complications that they can be left with as a result of that brain damage. Doctors use several tests to diagnose encephalitis, including imaging tests such as CAT scans or MRIs, to check the brain for swelling, bleeding, or other abnormalities. An EEG as well can be added to this list, which records the electrical signals in the brain to check for abnormal brain waves. Blood tests to confirm the presence of bacteria or viruses in the blood, and whether a person is producing antibodies, specific proteins that are there to fight infection in response to a germ. They could as well do a lumbar puncture in which CSF is checked for signs of infection. Mosquito control is important for the prevention of encephalitis. Antivirals such as acyclovir or Vera A for herpes simplex virus infection are very valuable as well. These antivirals should be started before the onset of coma. And once again, we are reminded that with the inflammation of the brain, there can be seizures, and so anti-seizure medications could be used to prevent or control seizures. A brain abscess is a collection of immune cells, purulent material, and other material in the brain, usually from a bacterial or fungal infection. Brain abscesses commonly occur when bacteria infect part of the brain. Swelling and irritation or inflammation develops in response. Infected brain cells, white blood cells, live and dead bacteria collect in an area of the brain. Remember that the brain is usually well insulated from infection by bacteria because it's protected by the skull and the meninges, in addition to the immune system and the highly regulated blood-brain barrier. Under certain circumstances, however, bacteria can invade the brain and cause a localized infection called an abscess. Brain abscess is relatively rare, accounting for 1 in 10,000 hospital admissions. Single abscesses occur in 75% of those cases, and the remainder of cases involve multiple abscesses. If not treated, brain abscess is almost always fatal. The sources of bacteria can be the middle ear, a middle ear infection. It can also be in the bony spaces in front of the middle ear called the mastoid area. So mastoiditis can also lead to brain abscesses, sinus infections, and an abscess tooth. Okay. So this type of infection, a brain abscess, usually begins in one of these ways. It spreads from a nearby site, and we already just mentioned it could be an ear infection, sinus infection, or a dental abscess. And blood carries the infection from farther away in the body to the brain. That's why it's referred to as a distant site. So brain abscesses can commonly occur when bacteria or even fungi infect part of the brain. Swelling and irritation, inflammation develop in response. Infected brain cells, white blood cells, bacteria and dead bacteria collect in an area of the brain. The typical causative organisms are Streptococcus and Staphylococcus aureus. Infections following a tongue piercing led to a fatal brain abscess in one case. So just 2 weeks after getting his tongue pierced, this young man developed dangerous lesions on the brain, which ultimately led to his demise 2 months after his initial admission into the hospital. Okay, so brain abscesses can be caused when bacteria or fungi travel from a distant site to the brain. In addition, that's kind of interesting as well, is that there are reported episodes of endocarditis as a result of tongue piercings. So both brain abscesses and endocarditis could result from having an infected tongue piercing. With brain abscesses, symptoms vary depending on the size and the location of the abscess. More than 75% of people with a brain abscess will have a dull, achy headache. For many people, this is the only symptom. The pain is usually limited to the side of the brain where the abscess is, and it usually becomes worse until the abscess is treated. Aspirin and other pain medications do not relieve the pain of a brain abscess. About half of the people with a brain abscess will also develop a low-grade fever. Other symptoms may include nausea and vomiting, neck stiffness, seizures, muscular weakness on one side of the body. The symptoms of brain abscess often develop slowly, usually within a period of about 2 weeks. Again, some of the common symptoms are headache and altered mental status, perhaps. Neurological symptoms just are dependent on the specific part of the brain that is infected. Again, a lot of these brain abscesses are caused by the spread of bacteria from a nearby infection. Diagnosing a brain abscess is not easy because the early signs are so general. For example, many things can cause headaches. And for this reason, the diagnosis of a brain abscess is usually delayed until about 2 weeks after the symptoms first develop. In some cases, people with brain abscesses develop seizures or neurological changes before the diagnosis is made. To diagnose a brain abscess, they'll make use of diagnostic tests such as a CAT scan or MRI scans. And they will provide pictures of inside the brain, and the abscess will appear as one or perhaps more spots. And if the diagnosis still remains uncertain, a neurosurgeon can remove a piece of the brain abscess with a fine needle. Antimicrobial therapy is the primary treatment for brain abscess. We need to treat the infection with antibiotics. If the specific type of bacterium is known, a targeted antibiotic is used. Otherwise, a broad-spectrum antibiotic is given to kill a large number of possible infectious agents. Antibiotics must be taken for a minimum of 6 to 8 weeks to make sure that the infection is eliminated. If the abscess can be reached easily and there is little danger of damaging the brain, the abscess may be surgically removed. In other cases, the abscess is drained, either by cutting it or by inserting a needle. A brain abscess can grow very quickly, typically becoming fully formed within about 2 weeks. Prompt medical attention is the key to relieving the patient's symptoms more quickly and minimizing damage to their long-term health. So treatment for brain abscess begins with intravenous antibiotics, chosen to match the infecting bacterium if known, or to cover a wide spectrum of possibilities if it's not known. Treatment usually continues for 6 to 8 weeks. So it is important for a client to see a doctor if they experience a nearly constant headache that gets worse over several days or weeks, especially if they have nausea, vomiting, seizures, personality changes, or muscle weakness. They need to seek emergency care. Without treatment, a brain abscess can be fatal. Most people with brain abscesses are treated successfully. Unfortunately, long-term neurological problems are common even after the abscess is removed and the infection is treated. For example, there may be lingering problems with body function, personality changes, or seizures due to scarring or other damage to the brain.